Welcome back to WBRZ News 2 at 4. I'm joined now by plastic surgeon Dr. Anthony Stevens. Welcome back. How are you?
Thank you. Doing fine. How about yourself?
Doing well, doing well. So it's Breast Cancer Awareness Month.
Right.
And you are here to talk to us about reconstruction options.
Reconstruction after mastectomy. And those are a lot of questions from patients that they have about that. And one of the most asked questions that I get, will insurance companies cover breast reconstruction? And the answer is yes, most will, because a bill was passed back in 1998. The Women's Health and Breast Cancer Act states that most insurance companies that cover mastectomies will have to cover breast reconstruction. And not only that, but they have to cover whatever you do to the contralateral side to make it balanced or symmetric.
Okay.
So those are good things to know when you need to have that.
Right, so what options do we have?
Well, the basic options are using your own body tissue, we call it autologous tissue, or using an implant, an autologous tissue, or using an implant such as the one that we have here. Now, if we're using our own body tissue, we can use take tissue from the abdomen, transplant it to the chest wall, make a breast mound, or we can use the muscle from the back along with a tissue expander, which is just a balloon, if you will, that's put underneath the skin. It's inflated over several months. Then it makes space for a nice silicone gel implant. This is an anatomic shaped implant. Most people would call this the gummy bear, which it provides for a very nice breast mound reconstruction. And from there, we'll reconstruct the nipple and the areola, and that can take up to 6 months time in some of these cases. So it's a good option, and it depends on the patient's health. It depends upon what the body shape is like. If the patient's heavy, if the patient's thin, then we can use different techniques, and it all depends upon the patient.
Okay, we've talked about this before. Is there a time frame when this should be completed?
Well, we're talking about either immediate or delayed breast reconstruction. You bring up a good point. Immediate reconstruction obviously is when we do it at the same time as the mastectomy, and usually that provides some of the best results. Most of the time, the ladies, if we're going to do radiation, then we cannot do reconstruction usually at the same time because it changes the skin envelope, and we may want to delay this 6 months to a year. And so it just depends on what type of breast cancer we have, and it depends on, again, their option, what they elect to do.
Okay, again, consult your doctor.
Absolutely, and every patient is different, as we've talked about every time.
That's right. All right, thank you so much, Dr.
Yes.
Anthony Stevens. We
Glad to
appreciate
be
you
here.
coming in. You're watching WBRZ News 2 at 4. We'll be right back.
When I